Hello, it's Kayla Baldwin, and today is 12/05/2024, and this is my second short video presentation on intestinal obstructive syndrome. And here's my notebook with a few notes that I have. To start off, I want to go over the clinical manifestations of intestinal obstructive syndrome. For starters, I'll just go over a few symptoms and signs that is noticed for people who are suffering from the syndrome. For instance, we have abdominal pain and distension. I work in a hospital again, so I actually see a lot of this at first. When I first started, I didn't know what distension was. Usually patients would refer to their stomach being distended, and really it's them being bloated, and you can tell that they're bloated. They're more bloated than usual, I should say. Another one would be vomiting, bloating, constipation, or reduced bowel movements, and you also have diarrhea, which could lead to dehydration and electrolyte imbalance. And then you have fever, and also you may have peritonitis, which is obstruction leading to bowel perforation. The three digestive syndromes that I decided to compare with the intestinal obstructive syndrome, number one would be icteric syndrome, or another name for that would be jaundice. Causes would be elevated bilirubin levels due to liver or bile duct dysfunction. Some symptoms that you might see in a person with jaundice is yellowing of the skin and sclera or eyes, and they might have pale stools and dark urine. And how it compares to intestinal obstructive syndrome is that it does not show any signs of bowel obstruction at all, unless you do further testing or the patient or person is complaining about abdominal pain. Number two is Ascix syndrome, where it's a fluid accumulation in the peritoneal cavity. Some causes of this fluid accumulation would be heart failure, cirrhosis of the liver, peritoneal carcinomatosis, and some symptoms of this would be abdominal distension, so there you go with the bloating, and dyspnea from pressure on the diaphragm, so you might be hard to breathe. Some differences between this and the intestinal obstructive syndrome would be that, of course, there's actual fluid accumulation without nausea or vomiting or bowel obstruction. Is it impossible for a person to develop nausea and vomiting? No, it's not impossible, but that's just not usually one of the signs nor symptoms. Next, we have malabsorption syndrome, and it's caused by impaired absorption of nutrients, and it's often due to Crohn's disease, celiac disease, or pancreatic insufficiency. Some symptoms of that would be diarrhea, weight loss, and fatigue. And the difference between that and the syndrome that I picked out was that there is no mechanical obstructions and symptoms are chronic rather than acute. Next, we have the diseases that are included with intestinal obstructive syndrome. And number one, we have intussusception, which is where one of the intestinal segments becomes shorter, and it leads to obstruction and ischemia. It usually occurs in infants and small children, and some signs would be mucus in the stool, and the symptom would be severe abdominal pain. Next, we have volvulus, which is the intestines twist around itself, and it causes abdominal pain, vomiting, distension, or peritonitis. And the last one, we have adhesive bowel obstruction, which is the formation of fibrous bands after having inflammation or abdominal surgery. So patients or people who have any type of surgeries dealing with their abdomen may develop these fibrous bands, and some signs and symptoms of that would be nausea, bloating, and abdominal pain. Thank you, and have a great one.